Hawkeyes play last weekend?
They played Thursday evening, I think it was.
Oh, that's right, they beat Minnesota. Yep,
Gophers.
the Golden Gophers. All right, good morning and welcome to our now weekly press conference regarding the local Kosciuszko County response to COVID. This morning we're joined by Kurt Carlson from the Bowen Center, our county testing partners, and Commissioner Carrie Groninger from the Kosciuszko County Commissioners, and Dr. Bill Remington from the Kosciuszko County Health Department. So I think let's just get started. I'd like to start with Kurt. I think the testing is kind of our barometer of where we're at. And Kurt, if you want to go ahead and talk a little bit about the expansion of hours at the testing site and what you're seeing over there.
Thank you, Mayor. Yes, we had over the summer, as you know, hovered around 10 people a day. That has just been escalating, and then we hovered right at about in the 160s for a few days. Yesterday we were up to 198. So you can see this dramatic escalation of the demand for testing. About 43% of the people showing up are symptomatic. And that was something that Bob Weaver asked us to look at. We had not been looking at that before. Age-wise, in the past, the people we were testing were older. Now the greatest number of tests are 11 to 20-year-olds, followed by 21 to 30-year-olds. There's a small handful of younger children, and then it just sort of drops off. So I think in the past, where most of our testing were older citizens, now it's the younger group, and that's probably, let Dr. Remington weigh in about whether that's the impact of the Delta variant. Staffing up, again, we had dramatically reduced our staffing. You don't need a lot of people there if you're only seeing 10 people a day, so we dropped down to 1.5 staff. As of yesterday, we were back up to 6 staff, including a couple of volunteers. We retained one of our staff members who had accepted another position somewhere else, and given this urgent need in the community, decided to stay with the test site. Gamal this morning at 8 o'clock was interviewing another candidate, so hopefully we'll have a robust staffing pattern to make sure we continue to meet the demand, because at this trajectory, we're headed back up. I hope we don't get up to the 400 a day we were seeing last year. We're still doing the testing for all the school systems, both private and the public. And I want to say thank you to a couple of volunteers. Apparently the fairgrounds has allowed a couple to be there and help at the fairgrounds in exchange for no rent to park their RV. Don't know what that arrangement is, but they have been helping us with traffic management. A complete volunteer, very enthusiastic, very helpful. So I don't know the name of the person, but I intended to go out and shake his hand and thank him for that volunteer effort, because it's really helped. I'm sure if you've been to the test site, you realize that traffic management is a part of the whole scheme of things, and I appreciate that help. So again, it's a privilege to serve, and we'll staff up to meet the need.
Kurt, would you review the hours of testing that have been expanded to, I believe,
Sure.
6 hours a day?
Yeah, the Tuesday evenings, so yesterday was our first, and that was, I think, from 2 o'clock to 6 o'clock. And then we're going in the, Wednesday, Thursday, Friday, and Mondays when we're open. That is 9 to 3, I believe. And then we're doing every Saturday, and that, I believe, is 10 to 2.
All right. Kurt's obviously and the Bowen Center have pivoted to handle this increased demand over the last month. I know administratively it's a tough chore finding staff, being able to support that with the minimal funds that the State Department of Health is providing us. Certainly am appreciative of the county and our city working with them to try and help support that testing site, again, as the demand is high. As Kurt mentioned, this is a critical need for our community. This is the test site, and the quality of care provided in the rapid tests environment is so important as we try and navigate this thing. And this is truly a community effort, but the Bowen Center is pretty much leading the charge on this, and we're certainly appreciative of that. Just again, trying to keep our costs down, but not suffer in what we offer and provide for our citizens. So thank you for expanding those hours, and hopefully that demand will drop here at some point. We won't need to be as concerned, but for now we're kind of in the full mode, if you will.
We appreciate the support.
Thanks, Kurt. All right, Dr. Remington, let's talk a little bit, probably a little bit about a lot. I know you've got a pretty extensive sheet here of information, so I'll let you dive in.
Sure, thanks, Mayor. We still continue to see a significant surge of Delta-sprung cases of COVID in our county. We're close to 11,000 cases since over a year ago. We're up another 300 cases at least since last week. 131 deaths. We were 128 a week ago. We remain at an orange advisory per the Indiana Department of Health's color-coded county-by-county advisory. We were orange a week ago. We were blue back in May, which was more favorable. Our positivity, which is one of the things that metric follows closely, is up to 12.5%. At our worst in November, we were 26%. We were 7.8% 1 week ago. That's significant positivity. We really haven't seen that positivity until the winter last year, mid-January and mid-November. So both sides of that mountain peak of November, we're about halfway up the mountain slope on either side with what we're seeing right now as far as positivity. We're averaging 44 new cases a day, 134 at its worst in November. We were at 35 new cases a day average a week ago, so it's up. 318 weekly cases per 100,000, another metric the state watches closely. We were 217 a week ago, so that's up. Indiana hospitalizations are up, another 300 or so from a week ago. Still down about 1,000 from where we were in December, which was the peak of hospitalizations. Indiana deaths, 7-day moving average, is about where we were a week ago, but quite south of where we were at our worst in November. Vaccination stats, a little bit better, 6.3 million doses across the state of Indiana, 3.1 million Hoosiers fully immunized. We were 6.2 and 3.1 respectively a week ago, so just about the same. Kosciuszko County, we've seen another 300 so people immunized fully since we last met. We're up to 42% of those vaccine eligible, that is 12 and older, are now fully immunized in our county. As far as emerging topics, the hot topic is the governor's executive order from a week ago and the Indiana Department of Health guidance which followed. It doesn't take the foot off the gas with expectations of communicable disease control as it applies to COVID. That's clear. It does offer a bit of an evidence-based olive branch to schools to be fully masked, again, framing from a highly publicized, very sophisticated and large scientific endeavor with Duke University and a consortium of schools across North Carolina during the last quarter of last school year, which involved several weeks of Delta. You wear a mask, you stay in school, basically was that message. And the State Department of Health here and the governor's executive order of last week strongly springs to that motif and that evidence. I sent out a strong letter of support as the health officer for our county to the school superintendents in our county just yesterday morning, reflecting my full support of that executive order and the Department of Health guidance from the state that followed. And I understand there was a significant Board of Health meeting last evening in Warsaw. I'm sorry, I had a conflict that I couldn't change and could not personally make that meeting, but my letter fully supported them considering a fully masked environment. That's the big hot topic this week. Vaccinations, third dose of the messenger RNA vaccines are now for immunocompromised patients. Boosters, that guidance is pending. For the rest of us who've had messenger RNA vaccines or any vaccine, don't go run and get a booster now, it's premature. Unless you are immunocompromised, then that's called a third dose rather than a booster. We at the health department continue to offer COVID immunization Monday, Wednesdays, and Fridays in the morning. We offer all 3 vaccines patients may choose. We have been supporting innovative mobile clinics with partners such as Warsaw Wayne Fire and the Bowen Center and others. We have more work coming up with at Our Lady of Guadalupe Church, Grace College, and Warsaw Powder Coating and Etna Green, just as examples, and I think there probably are more. And that's great. If you'd like a mobile clinic, please call the health department. The state also offers your direct access as community members to request a mobile immunization site. Take advantage of those. We can try to pivot resources either from the state or our local resources to be innovative and come to you with vaccines. You can get to COVID immunization in a number of ways. rshot.in.gov still works. Schedule, that works pretty slick. 211. Go to your pharmacy. You can walk up and see if they'll offer you a vaccine. Let me just say back to the governor's executive order in our position as a health department. When cases were waning in June, I put out a position paper that we sent to the schools saying basically we're here to support in-class learning. And we largely will pivot from the State Department of Health's guidance, but if we sense it is departing from our community and its temperament and its epidemiology, which we've tried to be strong with in our health department, then we would be willing to depart from state's guidance. Historically, all through this pandemic, administratively, it has served us well to be joined at the hip with State Department of Health guidance through this pandemic. So that was my personal position in reflecting, again, conversations we had had internally at the health department through early summer. It was clear that we weren't the only county thinking like that. And in short order, the State Department of Health made it very clear there were ongoing expectations promulgated largely through the Indiana Administrative Code and the communicable disease rule that you will report these cases. You will quarantine close contacts. You will isolate sick people with COVID. You will test to get you to that understanding. And that came stronger and stronger in our windshield, not just our health department, but in the communiques that went forth from the State Department of Health across the state to every local health department. So it was getting a little uncomfortable to not reflect that joined at the hip motif. But I thought, just knowing our community, we weren't there, particularly as schools started up. I didn't think we'd be able to have a fully masked environment. And again, the cases were quiet in June. But late July, August, the cases, here they come, right? And that's why we're here again. So we were thrown a curveball by COVID Delta. So at this point forward, our health department will go back to that administrative motif that served us well through the heat of the battle for the previous 18 months, and that is we will be joined at the hip closely with emerging State Department of Health guidance. We will reflect that in our temperament. It will reflect that in guidance with masks and social distancing and congregate events. And we'll get through this. There'll be more variants to come. Eventually, we'll have to reset, I think, our set of lenses, our framework as to how we approach this collection of novel SARS-CoV-2 and its variants. But let me say, as long as we continue to stuff ICUs full of patients, some hospitals diverting care, and as we see deaths go up, we just can't take our foot off the gas pedal just yet. We just cannot. Someday, when this population's immunologic memory is such, either from more robust immunization rates and/or personal experience with COVID infection, I would have to think that COVID, like any novel respiratory pathogen, eventually will have a softer footprint. I thought we were there in June. I was wrong. Eventually we will, and I think we'll have those strategies soften up when we get there. It'll be all about the epidemiology, particularly not just the cases, but hospitalizations and deaths. What is the disease burden of this novel pathogen? It's still very significant, much to my surprise. This Delta variant is really stirring the pot. So we're there. That was reflected in the types of conversations at the Warsaw School Corporation's Board of Health last night, as I understand it. It was in the temperament of my letter to them and other school districts yesterday morning. We will be that type of health department at this point forward, reflecting largely the emerging State Department of Health guidance. Thanks.
All right. Thank you. Again, just to talk a little bit about the Vaccination Clinic. Again, vaccinations are available out at K21 Monday, Wednesday, and Friday from 8:30 to 10. We'd like you to get on and register, but walk-ups are available. Our Lady Guadalupe will be having their second shot clinic on the 18th with the Warsaw Wayne Fire Department assisting. There will also be a clinic out at Grace College next Tuesday on the 2nd and the 19th. I think Dr. Remington mentioned, or I saw in the notes, that all 3 vaccines are available and you can request your vaccine of choice. Fire department is also doing another clinic, I believe, I don't know the date, but went on a powder coating in Etna Green for their employees. So again, I certainly echo Dr. Remington's concerns about the variant, and we know the vaccines are offering to me the most important way out of this thing, and I know they'll certainly appreciate the health department and Jeannie DeWild out at K21 Pavilion. I know Bob Weaver's working hard to make sure we've got supplies. Our health department's doing a great job trying to promote the vaccination, working with our fire department, doing the mobile clinics. This to me is still the focus of our efforts to try and mitigate these multiple future variants, if you will. And I do believe this is the way out. So that being said, I did want to talk a little bit about what the city is doing as far as any mitigation protocols. Essentially, we're looking at primarily concerns with indoor gatherings in our city buildings. We will be encouraging masking in all city facilities and providing masks at the entrances to the buildings. We'll continue to maintain social distancing. I know our city hall here will be retooled yet this morning to spread the seats out when we have our public meetings. We've got barrier shields that will be reinstalled, hand sanitizers, of course. Indoor activities and meetings will be limited to 10 people in person in city buildings, and we're going to try and hold all those meetings here in the council chambers where we can spread out. And obviously, the city facilities and departments will continue their enhanced cleaning protocols. If the county is designated a red advisory level in the Indiana Department of Health dashboard, all of our public meetings will transition to a virtual format. Again, that's if we hit red. And as well, the red advisory level will also trigger that all internal city meetings, more than 10 participants, will be required to be in a virtual format. Our emergency responders are continuing their COVID protocols when they interface with the public on emergency runs. I won't go into details on those, but those are obviously continuing. Again, we're looking at the Parks Department as trying to control and minimize concerns with large indoor gatherings. To that event, the 2021 Daddy's Little Sweetheart Dance, a very popular event at the Pavilion, has been postponed to February. And again, when feasible, larger events will pivot to an outdoor format. For example, the 2021 Light Up the Night Christmas event. Participants for smaller socially distanced indoor programs will be limited to 20 participants with masking encouraged. And again, the majority of programming events will be held outdoors. Talking about outdoor events, I know we've got several outdoor events this weekend. They are working with the health department to maintain protocols and safety protocols. But with our outdoor events, there's not probably as much concern as the indoor events. But we're allowing the health department to work with the organizations to make the final call. As you know, the Historical Society's got an event. There's a 9/11 parade this weekend. The Kettleheads have a tasting from, I think, 4 to 8, as well as the chamber-sponsored Taste of Kosciuszko. So those events are all pretty much outdoor events. There is one event under a tent, and again, we'll be working with the health department to make sure that safety protocols are established for that. But the health department, as you just heard Dr. Remington mention, will be following state guidelines as advisory levels change. So, Carrie, anything coming your way from the county?
Not a whole lot of changes. I mean, we never took our barriers and stuff down, hand sanitizer, those, and the social distance. I mean, all that stuff's still in place, so we'll continue on with that. There are no changes in our meeting venues or anything that we've got going on. We don't really have any large events planned at this point. So I know we have an outdoor employee tailgate party, I think, on Friday, but it is outdoors, just cooking some burgers for the employees. But I know just making sure we've got the resources for our county health department and places they can test and give vaccinations. So, thank you.
Thanks, Carrie. Anything else before we open?
Just one final plea regarding the Bowen Center, Kurt Carlson, and the effort for testing. They took on a bit of a lemon when we asked them to take on this state grant to do our testing. We just didn't have the staffing at the health department to commit to the expectations of testing. And here we are again, really needing it and flocking to it. It's underfunded. It was a lemon. That's why I think so many counties just didn't want to go there. We could use benevolence. And here's a specific request. If any of you out there have opportunity to be benevolent or a connection with a foundation or some entity, help us pay the rent to use the fairgrounds. It's been a great venue. It's achievable for many people in our county to get to the fairgrounds. They know where it is. We have a rent check due every month there. We could use some help with that. Please consider reaching out to the health department, or more specifically, the mayor or Kurt Carlson at the Bowen Center, if you are able to contribute. We would greatly appreciate it. Thank you.
All right, I'll open it up for questions.
Isn't there federal or state money available to help pay for the rent?
So we had a grant through the Indiana Department of Health for testing, and that's what has been the largest source of funding for that publicly funded testing site. But it is underfunded, so we've had to reach into pockets from CARES Act money, both city and county. They've been willing to do that. That coffer is getting lighter. We don't know how long we're going to need this large queue or large space available to handle large queues. It all depends on what COVID does in the surge. I mean, hardly anybody was coming through the queue in, late May, June, right? And here we are again. Feels like Groundhog Day from a year ago. I don't know, but I don't know how long this is going to go. And we just really need that space right now. And we need some money.
Yeah, the testing side, correct me if I'm wrong, what we've agreed to with the state is to run the testing through next June. Is that correct?
I believe that's where our grant is now.
Essentially, there's a year's worth of testing we are required to do with that evening hour and Saturday time frame. Certainly need to be wary of how long this could go on, and if and when we'll have more spikes. Again, I defer back to the vaccination issue and how important that is to try and finally get this thing to wind down. I never would have thought we'd be sitting here in May when we said we're done with these press conferences, but here we are, and this right now locally is very problematic.
Right, absolutely. I appreciate your emphasis on immunization. I got distracted in some of the other issues here, but immunization, honestly, despite the breakthrough cases with it, which are disappointing, it's still, I think, our best and quickest way out of this pandemic. So please consider immunization if you are vaccine eligible. Thanks.
I don't have kids, so could you, the kids who are coming down with COVID, what kind of symptoms do they have, and how severe is it? Can you kind of, because I don't have kids.
Right. So still largely respiratory symptoms, fever, constitutional symptoms, achiness, tired, high fever, many of them, cough, congestion. So that's a kind of a non-specific array of symptoms, right? Any number of viral pathogens can do that. We're not in influenza season yet, but influenza can do that. So that's why testing has been so helpful to try to sort this out and to make the case, especially when we are doing things like isolating the sick and quarantining close contacts. That hinges. You do that more robustly if you have something objective to hang on to, and that's a test result.
Dr. Remington, I think this morning Teresa sent out some information kind of comparing last year's COVID cases in the schools with this year's COVID cases in the schools, and I think that's a pretty compelling point for what was discussed last night's school board meeting, and pretty much to your point of where we are right now. Would you mind bearing those out for us?
Sure. Again, kudos to our communicable disease department, if you will. It's really mostly Teresa Reed. And the epidemiology we've been able to craft together from our local numbers. That, I think, really helps us have a finger on the pulse. And Teresa pulled some numbers together for us in the last couple weeks. And it's very clear that the start of school has been bumpy this year compared to last year, just with school-age cases. She put together a graphic for us this week that shows, just as a for instance, from the first week in September this year, 60 school-age cases. Again, it's just the sample size appropriate for our county, which is not huge. But nonetheless, here it is, 60 cases September 1st to 7th this year, compared to 8 cases of the same time frame a year ago. All right. In August, the last 2 weeks in August 15th to 30th this year, 79 cases. A year previous, 11 cases during that same time frame. Now again, some caution, our sample size is relatively small, but still, this is consistent with what I was feeling as a clinician as well as a health officer, is that there were just more cases this year, more cases involving school kids. It was in the classroom, kids going to school sick. It's a mess. It's just a mess. We were universally masked a year ago. It was Alpha, if you will, a year ago, and not Delta. Delta is, it's showing its teeth. It's just what the scientists have said. It's just so much easily transmitted compared to the Alpha strain. It's really contagious. The viral load's high, transmission, a lot of asymptomatic transmission, which is true of many viral pathogens, like influenza. You shed the virus robustly for 24, 36 hours before you even know you're solidly coming down with something. And you really shed the virus the next 2 or 3 days at least, pretty robustly. So COVID's kind of showing itself to be that way too. Immunization's got to make a difference. I have to think the viral load's lighter, but there's been some significant press to even immunize people without symptoms right before they come down with their breakthrough case, being able to shed the virus. And maybe those who never become ill despite immunization, they find evidence of it in the front of the nose, and apparently with case contact work thereafter, suggesting that those asymptomatic patients, although they were immunized, were led to contagion. Others around them became clinically ill. So that's hard to piece together in real time. Those studies are hard to come by. But this Delta thing is a real deal. So.
You mentioned influenza season. I mean, that's coming up, I think.
Yeah, so influenza, from November to April typically, and most years doesn't really get running heavily until after Thanksgiving. So now is a great time to get a flu shot. Anytime between now and Halloween is a great time to get a flu shot. There's no reason to avoid a flu shot just because we have COVID, or because you've been immunized or want to get immunized with COVID, get a flu shot too. No problem. Anything to reduce the community footprint of people with fever, chills, coughing. The less of that, the better.
Yes, sir.
Yeah, given some of those statistics, those are pretty startling numbers that they gave last night. So given those stats, is it your belief that in-person learning environments would collapse without a mask mandate?
That's the main impetus, honestly, for the governor's executive order, the State Department of Health guidance, and my strong letter to school boards school administrators yesterday morning. It's all about trying to pull off in-person learning. That's what this is all about. I'd love to not have to do masks, but I think if the rate we're going, if we don't do something, it's going to be back to virtual classrooms. Nobody wants that.
So right now, Tippy Valley is doing some virtual learning at least 2
Okay.
campuses. And
Yeah.
then Warsaw would be the first school corporation in the county to adopt a mask mandate. Do you have any understanding of what the other schools?
I did not have opportunity yesterday to have personal conversations with those school superintendents. Yeah. We would encourage them to consider, that's what my letter is all about, that went to them yesterday. Mm-hmm. I think that olive branch, if you will, of reframing case contact work and resultant quarantine mandates in classroom settings is huge with that governor's executive order and the State Department of Health guidance. That was brilliant, honestly. And it follows the science as best we know it. That large study from North Carolina, 1 million some covered students and staff, over 100 school districts. I mean, it was a massive study, real time, not speculative, very impressive. And they sprung from that. So if you go to fully masked, it's easier for these schools. You don't take out the whole kindergarten classroom or half of it if Johnny ends up having COVID after all. If everybody's masked, it's a much different result. in the next few days for that classroom. More kids remain in school. That's good. And the science supports that it's okay to behave like that. So,
We probably discussed this previously, but is there a certain kind of mask that you would recommend more than others? I see that in debates
yeah,
online.
right. And I don't know that I don't have the final scientific word on that. A mask that fits well. There's been some speculation the cloth masks aren't as good. I had been wearing a cloth mask, but personally brought a paper mask in, one of the surgical masks from the office today. I don't perfectly know. Anything to reduce droplet transmission. All these masks, apart from a perfectly fitting N95 mask, do not perfectly work with true aerosolization. That's, again, using that in a technical sense. Large droplet transmission versus aerosol transmission. Those are two different things. You mitigate them differently if you're serious about it. So, again, you kind of pick your battles in real use. And so any masking would help with large droplet transmission.
All right.
I have one more question for Kurt. I mean, I know previously when we had the press conferences, we talked about mental health and stuff. Anything new or different since May as far as the mental health and dealing with this, or?
Yeah, and I don't know that I speak locally so much as an article I heard nationally about the number of suicides from being confined or isolated. And within the state, I know that was a concern also. Some of those are intentional out of whatever created their need to sort of do away with themselves, and others are accidental overdoses. They're using drugs and it just gets away from them, and there's nobody there to help them that might have been there before. Again, if kids have been going to school, kids have been out more, so there's more eyes on the division of welfare department in the past. They're out and looking at them. Kids are in school, so there's more eyes on kids in school. So I'm less concerned about that because they are getting identified. We certainly have a really good working relationship with a lot of schools, and again, while they've been able to get back in school and open up society, the problems were better identified and served. Now, if we're going to start going back to quarantines and shutdowns and things, then all those things I was concerned about last year reoccur. Kids not being seen, adults who are depressed or using drugs not being able to be saved.
All right. If there are no further questions, I would suggest that we'll be back here again next Wednesday. We'll be following the numbers closely this week. We'll see where our advisory level is. Again, to just articulate, Dr. Remington mentioned we are orange, and I assume that will be posted at noon today on the State Department of Health website. So we will maintain our orange advisory level for the next week. So just to make sure everybody understands that. With that, we'll be back here next Wednesday at 8:30. And again, if there are anyone out there that has the need for any type of mobile vaccination clinic, please contact the county health department or my office, and we'll work with our fire department to try and get that arranged. So. All right. Thank you, Dr. Remington, Kurt, and Carrie. Appreciate it. And we'll be back next week. Thank you.
Thanks, Mr. Mayor.
Thank you.